One of the things we know about COVID is that it has disproportionately affected people from deprived communities and from Black and Asian ethnic minority backgrounds. So one of the questions is whether or not we should be particularly targeting those people for vaccination. Now, the JCVI did consider whether or not to have a programme like that, but they felt that the factors underlying why certain communities were more affected weren't that clear. And it's a combination of things. It's probably to do with factors like a high incidence of having some of those underlying risk factors, a high prevalence of things like diabetes, hypertension, sickle cell disease. These are all factors which predispose to getting worse cases of COVID. So I think the message is that when you're called for vaccination, it's really important that you come forward. And we need to make sure that the programme is accessible as possible, particularly to those communities who've been most affected. And we hope that in each local area, people will be working with local communities and local stakeholders to ensure that they can engage with the communities who are most at risk and make sure that they come forward for vaccination.